Mr. President, the government has been shut down for nearly a month. It's the longest full government shutdown in American history. And it all began with the Democratic leaders' desire to play politics with people's lives and paychecks. Americans, including those in Louisiana, are paying the price. Nationwide, 1.4 million federal employees, many of whom, of course, are living paycheck to paycheck, are furloughed or working without pay. 13,000 air traffic controllers have already missed one paycheck and will miss another soon. SNAP, the Supplemental Nutrition Assistance Program, food stamps, these benefits run out November the 1st in many states like mine, and that's just 2 days away. In Louisiana alone, that's 804,000 individuals, including 312,000 children, relying on SNAP. Now, this is not an abstract ideological issue. We are literally talking about food on the table. SNAP can be the difference between a child having a full belly, going to sleep, waking up the next morning, going to school happy, and that same child asking their mom when is the next time they'll eat a meal, going to bed hungry, and doing poorly the next day. Republicans are working to extend the program. I'm on a bill to fund SNAP, but it looks like we will not have Democratic support to pass. Mr. President, there's a lot of empty dinner tables and a lot of children going to bed hungry. Democrats have voted against reopening our government 13 times. 13 times they have voted to deny children food, sending families to food banks instead. I'm told that food banks will not be able to keep up. Federal workers, single parents with young children, walking into empty food banks. That's coming from a party that regularly claims that they are the party of children, families, and vulnerable communities. Republicans and the Trump administration are working hard to mitigate the worst parts of this shutdown. President Trump found the money to pay our troops through the generosity of a patriotic American. Senate Republicans voted for a bill to pay all federal employees, including air traffic controllers, who are working without pay now. Democrats blocked it. They're the party of no. And the bizarre part is no one's quite sure why, until one of their leaders said the quiet part out loud. The House Democratic whip acknowledged that Democrats are allowing people to suffer because of the shutdown, but said, quote, "This is one of the few, there will be families that are going to suffer, but it is one of the few leverage times that we have." This is the second highest ranking House Democrat openly confirming that working families are being used as political leverage. This is all about politics, not what is best for the people of our country. Now, they'll tell you it's about health care, but their position crumbles under scrutiny. If it were about health care cost, why would they make people suffer more in order to change health care policy rather than reopen the government and negotiate with Republicans on solutions which actually lower health care costs? Republicans have repeatedly said we'll negotiate how to lower health care costs, just not while Americans suffer. Our position is clear. In the shutdown, and then let's talk about health care. Seems reasonable. You might ask why they're still voting against reopening the government. It's because they know that their proposals on health care won't actually lower health care costs. Under Democrats' current plan, premiums still go up next year. Not to mention, their proposed solution is just aimed at papering over the mess that Obamacare created, because the facts are clear. The Affordable Care Act did not make care affordable. All this seems like one elaborate attempt to save face. Well, it's not working, and more importantly, Americans are suffering. I repeat, reopen the government. Then let's have a conversation about the areas in health care we can address to actually lower premium costs and out-of-pocket costs for middle-income Americans. By the way, the Democrats' current plan will only affect 7% of the people on Obamacare. Their plan ignores 93% of Americans who will also see costs go up. We need to help all Americans by fixing our health care system, not just paper over the failures of Obamacare to help a few. I'll add, for as much as they talk about health care, the Democrats' shutdown is defunding important health care programs. As chairman of the Health, Education, Labor, and Pensions Committee, I led a bipartisan effort to protect Americans' access to affordable over-the-counter drugs. The members of my committee worked together to reauthorize the over-the-counter monograph drug user fee program, sometimes referred to as a MUFA. This funds the review process to bring over-the-counter drugs to market. Because of this shutdown, because of my Democratic colleagues refusing to vote to open the government, for the first time in history, a user fee program has expired, meaning patient access to new over-the-counter treatments for common ailments is in jeopardy. I'm a doctor. I want to tackle the numerous issues facing our healthcare system. I spent my whole career fighting for patients. Let's have a conversation about lowering costs for all Americans, like those on Medicare, those with employer-sponsored insurance, and small business owners who provide insurance to their workers. If Democrats are interested in lowering healthcare costs, as they say they are, reopen the government, pay our troops, and stop taking food from children. I'm tired of hearing people say there's no off-ramp or way out of this shutdown. Here it is. The way forward. Open the government.